Now to growing concerns over a possible triple threat looming over hospitals across the country that are already overwhelmed with pediatric cases of respiratory illnesses. And that's before an expected surge in flu and COVID cases. Eva Pilgrim is at a children's hospital here in New York with more. Good morning, Eva.
Good morning, Robin. This children's hospital behind me telling me they are seeing high volume this morning, and we are seeing that from coast to coast. The number of children in the hospital in the U.S. is the highest it's been in 2 years.
This morning, children's hospitals filling up across the country as cases of respiratory viruses spike, some now running out of space.
Almost every hour of a 24-hour period, we're completely full and we cannot accept any other patient.
Nationally, hospital beds for children are around 75% capacity, but that number even higher in some parts of the country. In these 9 states and Washington, D.C., it's more than 80%. In Texas, Tennessee, Delaware, Maine, and Rhode Island, pediatric hospital beds are at more than 90% capacity. At those hospitals with beds, many seeing hours-long waits.
We sort of haven't had a break. We've gone from COVID to RSV to influenza, and who knows what's next.
In Green Bay, Wisconsin, 5-month-old Bentley Phillips is hospitalized with RSV.
It was all in the matter of a 24-hour period that we had noticed one thing after another.
His mother saying she is grateful for the care her baby boy is able to receive, but warning how quickly everything changed.
It started with the wheezing. He progressed so fast. His oxygen was so low that we don't know what would have happened if we were home any longer than we were.
The flood of patients now forcing some hospitals to pause elective surgeries, others even having to turn kids away. Pharmacies feeling the strain too. Walgreens saying its pharmacy now filling weekly prescriptions of antivirals at a rate 10 times higher than this time last year. That number doubling over the last 2 weeks. Now, officials warning that we could see a triple-demic, RSV, COVID, and the flu, further straining hospitals as we hit the winter peak.
We're seeing the rise of 3 respiratory viruses, all of them going up around the same time. That's concerning. The good news is for 2 of the 3, we have vaccines that are highly effective at preventing serious illness, COVID and flu.
And doctors are telling us if your child shows any symptoms of having trouble breathing, you need to bring them to the hospital right away. These hospitals are very busy, Robin.
They are. And Eva, what is the latest that we're hearing on that Virginia high school where more than half of the students called out sick?
Yeah, Robin, nearly 1,000 students called out sick at Stratford High School in Fredericksburg, Virginia. Many of them reporting flu and gastrointestinal symptoms. The school was forced to close down to do a thorough cleaning. It has since reopened, but many of those students, hundreds of those students, are still out. The school now telling us that many of those students have tested positive for influenza A. They are still investigating exactly what happened. Robin.
I hope they all feel better very soon. Eva, as always, thank you. Joining us now is Dr. John Brownstein. He is an infectious disease epidemiologist at Boston Children's Hospital and an ABC News contributor. We always appreciate your insight, especially because you are witnessing this firsthand. You work at a children's hospital, also tracking national data. What are we seeing right now, and how concerned are you about this?
Well, good morning, Robin. I am actually quite concerned. Here in Boston, we're seeing incredible volumes as a result of this RSV, a steep early curve. And that's not just here in Boston, it's across the country. We're seeing beds filling up, and this is a real problem because we don't only deal with RSV, but we have the common cold and the need for mental health services for our kids. So there's a massive strain on our hospitals right now that I'm quite concerned about.
A massive strain indeed. And where are hospitals being hit the hardest right now? And where do you see it going over, let's say, the next few weeks and months?
Well, this is a widespread issue. 9 states already have over 80% capacity, beds full. 5 states actually have over 90%. It's really starting in the south. This is where we see the respiratory viruses begin and spread northward. So I'm worried here for the north, where we still haven't quite seen anywhere near the peak. Then you layer in COVID and a new variant, a flu season. That's going to combine to make a perfect storm for a real challenge for the coming months for all our pediatric hospitals across the country.
So what symptoms should parents look for that would tell them that it is time for their child to seek medical help?
Well, first of all, RSV is very common. So for most kids, they'll recover just fine in a week or 2. So it's not to create panic, but we should be looking out for wheezing, heavy breathing. You know, younger kids have a smaller air passageway and have a tougher time clearing out congestion. So any trouble breathing along with fever, aches, absolutely call your pediatrician. And of course, we have vaccines for flu and COVID. Make sure your kids are up to date on those.
Dr. Brownstein, thank you as always very much. Take care.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.